Cool. We are live. Right, morning, guys. I hope you are both very awesome. So we spoke last time about training plans, the good, the bad, the ugly. We got some really good stuff there, I thought. And now it's very much a case of all things injuries, because it's a big bane of people's lives, for people that sign up to any kind of physical goal, and particularly the London Marathon. So I've seen things over a decade of doing this, very common themes, and it's your world, guys. You know, you're two very experienced physiotherapists, and historically, physios are there to more of a rehab. People think of rehab as very much a you're broken, we'll fix you. But I think it's obviously changed a lot now. There's a lot. It's more about prevention is better than cure, and there's things that we can obviously speak about to get people in the best shape to hopefully not see you guys for rehab, but more kind of potentially see you guys and talk to you guys to get things in place so they're more biomechanically sound and less likely to pick up some of these common things that we're going to talk about. So it's over to you guys. I mean, there's a lot of pitfalls with marathon training and all the rest of it, but I mean, the first thing is, why do runners get injured?
Well, it puts a lot more load on the body versus many other forms of activity. So just the sheer impact, the forces. I think Gus mentioned a stat on the earlier podcast that, you know, when someone runs, was it 10K, Gus? They're loading their body through approximately, I can't remember what you said,
1.6 million kilos or something.
Yeah,
it's high.
And there's an old stat out there, I don't know how accurate it is now, but you know, when someone does run, it's approximately 2.5 to 3 times their body weight multiplied. So, you know, if someone's like me, 75 kilos, that's, you know, it's somewhere in the region of 100 up to 200 and 250 kilos that I'm actually lugging around when I run or loading my body. So it's easy to understand then when someone comes in without maybe any history of strength training or history of like loading, why tissues can become at fault or over time fail if things are done too quickly. And that's probably, you know, that's what the earlier podcast was about, how to maybe avoid those pitfalls. We're trying to encourage people to take their time and plan enough, give enough time in their training to actually allow those incremental, gradual changes to occur. But even the best get it wrong, and you know, periodization and training throughout the year is a key part of that. But even then, people just have certain factors that predispose them to injury. And you know, the biggest thing from a physio perspective, I think, is, you know, one of our it's not a nightmare client, let's say, because things can always be done, but a client that comes to us 3 weeks before a marathon and says, I've had this pain and it's been around for about 6 to 8 weeks, and we're like, well, why didn't you come when it first started? Because people, and I do understand that mentality. I'm in the same mindset sometimes, that if I have a niggle, I'll see how it goes. But if it's lasting longer than 2 to 3 weeks, it's time to do something about it. So, you know, that's quite a common manner. You know, that's a common presentation. Would you agree, Gus? Someone coming like almost.
Yeah. And as we were saying last time, the later you leave it, we're still constrained by the same kind of like biological timelines and how things adapt and how quickly they adapt. So that sooner you can sort something, the better. And most of the time, I'm exactly with Mike. I'm like, if you've had a niggle, if you run, you're going to get a little bit of discomfort sometimes. Crack on. 99% of the time, it's probably fine, especially if you're not training for anything specific. So if you do just think, you know what, I'm going to have 2 weeks off running, or drop my training load down for 2 weeks and then I'll go back to it, that's not a problem. But if you are training for a hard end date, and you've got, only, 16-week training program, if you take 2 weeks off that, that's quite a significant chunk of your training that you're suddenly not doing. And I'd agree with Mike in that, the people we see is almost always, for runners, it's 1% of the time it's the people who say, I tripped over and I sprained my ankle, or I can pinpoint the exact moment when I did it. But 99% of runners cite no injury mechanism. They're like, this has just come on out the blue for apparently no reason. And then it's when you get into the questioning, the reason starts to become a bit more clear. But it's very rare for people to be able to pinpoint a moment where they felt pain come on.
Yeah. The other thing is people also then, they love to self-diagnose as well, right? So you get the separate people either just do nothing, I'm going to rest this, do nothing. Some will then go straight to the doctors after 2 weeks rest, and doctors will say, rest more and have some painkillers, which doesn't help. We'll go into the symptoms versus causes. And then the others, will go on Dr. Google and think they're going to die, because you'll find, ultimately on Google, you're going to find a whole plethora of different issues. But the big thing is symptoms versus causes. How many knee problems aren't really the knee that's the issue, right? It's a different part of the chain that's normally dysfunctional, right? So
yeah, I think that's part of the problem with, in a way, it's almost a London, well, it's not London, it's just I think people that decide they're going to take up a challenge are probably predisposed to certain characteristics, in that they're a bit more analytical maybe, or they want to push themselves, so they're going to read around things, and as soon as something goes wrong, then they'll also then almost try and fix it themselves. And and it's this, I use this analogy a little bit in that, I can go, and if I have an issue let's say I've got an issue in other parts of my life that I'm not necessarily an expert in, I'll go and read around the subject. I want to understand how to fix like a shelving unit, or do some form of DIY myself, or maybe it's a legal issue or whatever. I'll go and read around it, and I can get an understanding of the problem, or give myself the context, but without the experience of the person, the years of seeing clinical cases and being able to build that sort of that knowledge base. Google really is just, it's a path to really nowhere. A lot of the time it can send people down the wrong path. Like you say, it can almost create a fatalist type outcome. They come in, they think they're going to have their leg chopped off, or their big toe, or whatever it might be. And in a way, it's just better to go and see someone quick, early, and it'll save you a lot of like headspace worrying about it, because you'll just be like, right, now I've got an issue. Yeah, okay. If it's worse than I thought, then you can deal with it. But if it's not as bad, you'll feel way more relieved, and at least you're going to have some like outcomes. Whereas if you're kind of trying to deal with it yourself, you're at best, you're probably gonna you're probably gonna arrive at some sort of close to being correct, but you're not gonna necessarily help yourself in the long term. So you just need to get in early, get someone to identify it, and then create a plan, a bit like the training plans, work with that person. In terms
I'd say with the Google situation, I like it when I quite enjoy it when patients are clued up about, they've clearly read around, they're educated, and they've got a bit of an idea. But if you type into Google knee pain when running, or shin pain when running, or even if you think you know what it is, you type in, shin splints, which is kind of an umbrella term that's not a diagnosis, but you'll get like let's say 10 million results in 0.1 seconds, and everyone has an opinion on training. So if anyone's ever ever run, they'll have an opinion on what's good and what's bad. And if you just come at it from a blank slate, you tie yourself in knots, because each article will say something different.
Yeah.
And there is a lot of bad advice. A lot of people have said to me before, like friends or people I know, saying, "Oh yeah, I was going to come and see you for an injury, but I didn't want to. You were just going to tell me to rest." So, and I had to do I was training for the marathon or training for whatever, and I can't think of. I could probably count the number of pathologies or problems on one hand, easily on one hand, that the only option in the short term is just to do nothing. Like, it is so rare for the primary treatment option to be, oh, you're just gonna have to stop altogether.
Again,
Even if you have a
sorry. Yes.
yeah.
Yeah. I mean, like, that's what we're conditioned to think. We're conditioned to think, go doctors, rest.
Yeah.
This is your world. However, like, the last thing people should be doing is doing nothing. You're right. It's more kind of stress fractures or that sort of thing where you need to be really, really careful. But on the whole, it's modifying the load. It's modifying and just being sensible and actually identifying the cause, which is what you guys do.
Yeah. And the classic one for that is tendon problems. So we see it's just like go hand in hand with running, really. So like Achilles tendon problems or tendon problems in your knee. And there is loads and loads of evidence to say that resting it just will not help. You'll feel better, so you'll stop running. You won't be doing the thing that aggravates the tendon. It will feel good, and then you'll go back to running, and it will be just as bad as it was when you stopped, if not worse. And then you get into these boom-bust cycles of doing absolutely nothing and then doing loads to catch up where you were from, and you never get any consistency to your training. So you're not making any progress from a training perspective. And the problem that you initially had is, in the best case scenario, no better than it was, no worse than it was, sorry, when you first stopped. And in the most likely scenario, just followed a trajectory of gradually getting worse. So if you're a runner and you've got a small, a niggle or something, and it's only been going a couple of days, I wouldn't worry too much. If you're training for something, I would probably go and see someone if it's still going on after a week, because you just want to, even if it's that person just saying, no, this is fine to train through, but you don't want to compress the timeline. You have to do something about it. But if you're worried about seeing someone because they're just going to tell you to rest, if they do, I would suggest you probably haven't found someone who's treated many people like this before, because it's so rare that that's actually the case, that you have to just, it's like we can't progress on. As you mentioned, like stress fractures, yes, you can't just run on a stress fracture. But
unfortunately, stress fractures pretty much end of the road for most people. So, but well, it is end of the road. They're out of the training plan. That it's just not safe to be. They're going to be booted. They're going to be, or whatever it is, wherever that stress fracture is, it's just going to take them away from. But the stress fracture, the diagnosis is often, it's not always arrived at easily, and sometimes you'll see people with stress fractures that have maybe been to one or two people prior to you, and it's just not going away, and they've maybe tried a few things, and it's just gradually been ticking along subtly in the background, and they can be missed. It's I don't think it's necessarily a sign of a poor clinician if things get missed, because I've had it a few times where people have been to see other physios, and we've found it, and I've seen people that I thought were out and out something else. Maybe early on in my career I probably missed them, but I'm probably a bit more sensitive to them now, a bit more, if they fit certain criteria, then I think I'm just ready to refer them on for further imaging and things like that. But I had a couple of, randomly before lockdown, I had two guys that came in with central foot pain that looked like what we call a Norton, not a Norton, yeah, a Morton's neuroma. I got the letters the wrong way around. So they had sort of symptoms along the line of that, but they also had like quite a lot of swelling in the midfoot, and I just around the sort of second and third metatarsal, and I just wasn't convinced it was, so I just referred them on, and they both had stress fractures from running and very little amounts of running. So I think it's not always clear cut with those types of things. So it's always better to come in and see someone than just kind of struggle on, because it's only going to make it worse long term.
We spoke about being a martyr last time, right? And pushing through the pain, and if it doesn't hurt, you're not doing it right, which is obviously a backwards mentality. So the load that obviously causes most issues through the body, we can be sensitive and talk about body weight and BMI if we want to go down that route, but it's obviously it's a talking point in terms of extra unnecessary load can obviously put more load through the joints. So I talk a lot about nutrition and safely dropping body fat, keeping strength, and that sort of thing. But also there's this whole other, our body is a master of dysfunction. It will hide things from us all the time, which is where some of these injuries can just sneak up on us. They will just sneak up on us. What else? How can we prevent these things from happening apart from modifying diet and being a bit careful with kind of that aspect of things? Runners can't actually identify the issues themselves or kind of look at biomechanical dysfunction themselves. What biggest bang for bucks things can people be doing now in terms of pretty strength work? I guess is the biggest one that people don't generally do in their training plans.
A simple thing people can do, we'll go into just as another aside thing, but a simple thing people can do is just looking at the biomechanics, and there might be, right now might be, if you're trying to empower people to take control of their training or thinking about how they can protect themselves, even taking a quick 30-second video of them running up and down the street towards and away from the camera, and then sending it on to you, and then you sending it to us or whatever, we'd happily look at those videos over the next 3 to 4 weeks and start a conversation with people to at least give them some insight as to whether their trainers might not be doing the right thing for their feet, what their hip and knee control looks like, because the whole chain is important. So that then leads quite nicely into the strength. There's two parts from my perspective that I'm always looking at when I have a runner in, and the first one is their interaction with the ground, but then the level of control they have from the ground up, but also the reverse down through the hips and into the knee. So I'm looking at what happens when their foot contact hit when they hit the floor. What's the rate of sort of pronation, or like, let's say, how quickly that happens, and whether the feet, the footwear they have are controlling that nicely, and then also I'm just looking for obvious signs in like their knee dynamics in terms of where their knees are going. Are they largely going in, or is there like lots of rotational elements? And these kind of things just give me an idea of whether their hips are and their legs are strong enough to control what they're doing. I don't know if that's a good summation from your point of view, Gus, in terms of what you'd be looking at with an assessment. Or
yeah, in clinic I'd do it on a treadmill, film someone on a treadmill. Obviously people don't have access to that at the minute, and you run differently on a treadmill, so it's not ideal, but it's just logistically the easiest way to do it. So it's one of the difficult things with biomechanics is everyone will run differently. There's plenty of people who won gold medals with a poor, in inverted commas, running technique. Yeah. So it's difficult to filter out the noise. So I think a video in isolation is probably not that useful, because if it's someone who's never had a running injury, does a bit of strength training, manages their load appropriately, and they send a video in, and it's not a textbook running technique, it's not something that I would really want to change because it's working for them. The things that have quite a bit of evidence behind them is if you look at someone from when they run from behind, if they're hit, you imagine where the level of your shorts are in standing, your shorts the top of your shorts would follow a flat line across your back. If that line is deviating from level, so if you imagine a spirit level on those shorts and that's tilting massively every time, as Mike says, your foot impacts the ground, that's associated with, not necessarily causes, but we know it's associated with injuries lower down the chain, and that will kind of dictate the amount your knee will cave in as your foot hits the ground, which again is associated with, doesn't necessarily cause running injuries. And then from the side, the main thing I'm looking for really is their stride length. So if you're running and you're reaching out a long way in front of you, and your foot is making contact with the floor in front of your body, you're essentially creating a braking effect, because every action will have an equal and opposite reaction. So if you push out in front of you, that's a way to decelerate. So it's essentially like driving a car with the handbrake on. You're just going to stress it more than it otherwise would be. So if you film yourself from the side and you're seeing that your foot is striking a long way in front of your body, it's probably not particularly efficient. That said, the women's world record is held by someone marathon world record is held by someone who's got a massive stride length. So it, on its own, is not, you can't just say, oh, that's bad. But if it fits with the picture, and you're saying you're getting these repeated knee injuries and everything else you're doing seems quite sensible, that then for me would be like a big thing, saying, okay, what happens if we just increase your cadence? And there's playlists on Spotify, you can just type in 180 beats a minute and run to that, and try, or a lot of watches will have that now, and just try and take more steps. Each step is less distance, and then there's less load going through it. It's more efficient. So those would be my two main things from a biomechanics perspective. And then, I think strength training, getting into that, because that does have a lot of bang for buck, really.
And it all has to be put in context. Like Gus says, if someone's not really got any issues, then I agree. If it works for them, we don't need to do too much. It's just being aware of potential pitfalls. And that's the value of screening. We're not, things can stand out in screening, but unless they're really strong indicators, then there's not too much need to change things drastically. We just need to be aware of them, and it gives us a reference point as well, which I think is valuable.
We're able to get people to screen themselves remotely. Are there things that we could get them to do?
I mean, Ron goes. I mean, I just think a straightforward, like I say, run away from the camera to the camera, and then something simple like a single leg sit to stand squat from a chair, and then these are simple things we can look at that just give us an indication of someone's ability to move themselves around. But again, it's got to be put in context of do they have a current injury or not, and that kind of thing. So don't know what you were going to say to that, Gus. But
it's similar. So I look at it quantitatively and qualitatively. So the qualitative is slightly, I guess there's just more pitfalls because it's open to interpretation. It's more subjective, whereas quantitatively still does have some pitfalls, but is easier to kind of standardize. So as Mike said, single leg squat from a chair, it's a triple extension movement, meaning the hip, knee and ankle extend simultaneously, which is what happens when you run. And we know that it's not really specific to running or marathon running, but people have had knee replacements. You can do more than 16 single leg squats, have a better quality of life, less pain. And if you've had a big knee ligament injury, and you're going back to a multi-directional sport, that requires you to react to something like tennis or football or netball or hockey, more than, I need to double check, I think it's 22 is kind of one of many factors that you would want to kind of tick off and say, do you just have the physical capacity to deal with the forces going through your body? So that would be like one test that would give you a qualitative and a quantitative outcome. That, and I think for everyone, number of calf raises you can do off the floor. There's a study done, depending on your age and your gender, this is what normal is, which isn't much help to marathon runners because they're not normal. They're running an abnormal distance. But if you can't hit the baseline, so for like, again, don't take this as gospel, but if you're between 20 and 50, if you can't do 30 calf raises from the floor on a single leg, that's a big factor suggesting like you just are not strong enough to deal with the load going through your foot and ankle complex or your calf complex. And if it's not able to deal with the load there and you're still running, that load is just getting shifted onto another structure.
Makes sense.
Makes
and I think from a strength training perspective, it's also important to think about when you put it into the training program. We don't like, well, I personally don't like to see strength training any time in like the build phase of a program. It's early season, it's off season, and maybe part of the base phase where they're building volume. But as the volume grows, the strength stuff really drops. You can't be doing too much strength training into a program. So it's almost got to be like, now is too late to really be implementing a full strength program. And we can, if we highlight issues, then yes, you need to try and correct those issues within the context of the training program to give them a better outcome. But you can't implement a training program now really effectively without potentially causing more problems, in my opinion. So I don't know what you think about that, Gus, whether you'd agree with that or...
Yeah, to an extent. I think, again, it's hard because it sounds fluffy saying it depends, and what does it depend on, and all those variables. But I'd say with most people, if it's your first marathon and you're not particularly used to strength training, trying to increase your mileage to higher than you've ever done before, and increase the amount of strength training you're doing at the same time, the wheels are fairly likely to come off because you're just trying to add everything simultaneously. If you're a more experienced either runner, or you go to the gym relatively regularly, or do home workouts relatively regularly anyway, you probably tolerate it a lot better because it's not a novel stimulus. It's not a brand new thing you're introducing. So I think while people's in the early stages, as Mike kind of said, as a base or their off season, but even now where your running volumes aren't going to be massive, if you're used to that, or you're used to strength training, you can probably drop in 2 strength training sessions a week and get some positive adaptation, i.e. get stronger or increase your endurance or whatever it is that you're trying to do. But yeah, as soon as you start hitting a decent weekly volume, and that there is no magic number that is over this amount of running you shouldn't be lifting, because it will depend on who you are. But I think it might be, if you're used to doing it and you've done it and you've been strength training for a while, even just putting one session in a week as a maintenance, that you will maintain what you have with one strength training session a week. So if you looked at what elite athletes would do, it's difficult because they have access to gyms and everything like that. But typically later in their program, they would actually keep the weight that they're lifting quite high it'd just be the volume would be very, very low. So they might be doing 2 sets of 3 squats, but at close to their maximum. So the amount they're doing is very minimal, but the intensity is just there to stimulate and maintain that strength, that underlying strength that they've developed in their off season. Because if you've built to develop that and stop altogether, it will start to drop.
Yeah, I'm probably thinking in the context of a masters athlete like myself. Who,
But even if you, I think the underlying message is if you're used to strength training or you're used to running, then you can probably keep in as your running increases, drop down your strength training, like Mike said. But you'll keep 1 session in a week will be fine. If all this is brand new to you, don't see that as a problem or a reason that you've got to beat yourself up, and just accept, like, okay, well, I'm not going for a specific time. I want to go and enjoy it on the day, and I don't need to have to build my strength now. I'm at a requisite level of strength where my body can tolerate what I'm going to do and can tolerate the increases in training that I'll do. And yes, if I'd started 6 months earlier and been in the gym 3 times a week and got really strong, I'd probably run it a bit quicker, but I've got no intention to run it any quicker. So why would I do that? I don't like the gym. I just want to run. That's not I'd never criticize someone for that being their methodology and thought process.
Yeah. Where else are we going from here? What's the apologies?
No, I think we're good. I think it's as we're talking, I think there's a million ways we can go with this. We can talk about activation work, and we can talk about warm-ups. There's a whole load of host things that can prevent, and but we've hit the common injuries. Any takeaways then, guys? I think any takeaways that people now, again, we're here to try and inspire people to lace up their trainers and get out or be more active and do things that will help them reach their goal, which is to get on the start of the London Marathon. We spoke about modifying loads and dropping the ego with actually running. What can people be doing now? Biggest bang for buck exercises, advice that we can give them. I mean, what would you recommend now?
For me, if you were going to do, let's say you put in a 4-week block of strength training now, because they've listened to what we've just said and said, no, I fall into that category where I can do a bit of strength training. I wouldn't do more than twice a week. I would keep the sessions fairly short. So, no more than 30 minutes probably. And I would prioritize exercises that have that triple extension component. So hip, knee and ankle all extend together. So if you're it depends on how strong you are. If you can, squats from a chair are probably too low level for most people, because it's only 50% of their body weight per leg. So I would do single leg variations, like single leg squats, whether that's from a chair, or if you're really flexible and strong and you can do pistol squats, then great, but I can't, so I wouldn't worry if you can't. A step up onto a relatively high surface like a chair or a coffee table, some kind of split squat, like a lunge variation, and then some kind of like calf raises off a step. If someone came in and said, this is what I'm doing, does that sound sensible? I'd be like, yeah, that I don't.
It's something that everyone can do. There's
you don't need any extra equipment. If you've got it and you can make it a bit heavier because it's easy, then that would be good. Runners it's almost counterintuitive, but they will benefit more from exercises that fatigue them quickly. So if you're fatiguing between 5 and 10, maybe 5 and 12 repetitions, that would be kind of a decent training zone for you. You're already getting loads of endurance through your running. So by you doing, I'm going to do 25 split squats. If you don't have any other weight and that's the only way you can fatigue yourself, then fine. But if there's any way you can make the exercise more difficult or pick a more difficult exercise to make you fatigue quicker, you're going to get much more bang for your buck than that. Those would be my take home exercises. And then with that, there's loads of other training types. big misconceptions is that I've got to do a really thorough warm up before I run. I think yes, I would definitely do something before, even if it's just a couple of those body weight based movements that replicate what they're about to do, and do a couple of walk for 5-10 minutes. But if you're doing similar type movements and elevating your heart rate and elevating your body temperature before you start, that's pretty much all you need to do. There is very minimal, if any, evidence for stretching. I've never really understood what activation exercises do. I would just try and pick exercises that replicate what you're about to do. And then anything afterwards, when you get back from how do I recover? Your first things are eat and drink. If whatever you're doing is keeping you up and stopping you go to bed at a time to let you get enough sleep, don't do that thing. But if you like stuff like having a warm bath or a cold bath or foam rolling or stretching, all of that is absolutely, I buy into that. I just wouldn't say you absolutely have to be spending 20 minutes a day stretching to make sure you don't get injured, because it's just not supported with any kind of evidence.
I think particularly with running, people do ask me, do I warm up when I run? And I often just say the warm up is, the early part of the run. I just don't go I don't go into the main part of the workout from the very beginning. I just start at a lower level and let my body accustom to the run, get my heart rate up, and let my old bones and joints get oiled up, and then maybe after half a kilometre to a kilometre, whatever length of time that might be, where I feel comfortable. Everyone's different. What their body is ready for. Then you can start to go into the workout. So just factor in that into the warm up. Can just be the early part of your run. And yeah, I think Gus says about doing some movement based activity prior to that. That's great. It's just moving and getting your body ready for something that you're going to do. But there's minimal evidence around stretching. Anecdotally, I think it does help in some individuals, but everyone.
I agree.
Yeah.
But it's hard to make a blanket. Everyone should do this, because it's just nothing to back out with.
Yeah.
And then the final thing I just thought of is kind of plyometric training. So plyometrics is essentially anything that involves jumping and landing. And if you went away and Googled that for runners, you would find loads of studies backing it up and saying, yeah, this absolutely does improve running performance. It is one kind of training modality that I'd be quite reluctant to advise people just to go and do on their own. If you're doing body weight strength based exercises once a week in your early phase, you're probably not going to make things worse. You're almost certainly going to make things better. It's very, very easy to overshoot impact work, and that's in someone who isn't gradually building up the amount of impacts they're doing every single week for months. So I think unless you've got a strength coach or a running coach or a physio or someone who is essentially an exercise professional, and especially if you don't have any kind of training history of doing plyometric based exercises, I'd be really cautious, because it's very easy to tip it over the edge and just come in and see someone like me or Mike.
Guys, yeah. All right. Well, look, I think we'll leave it there on this one. I think it's awesome. It's giving people things to think about, and we'll follow this up with more and more and more. My head's very active now in terms of what we can talk about and where we take this.
Okay.
So that's awesome. Much appreciated, gentlemen, as always. Yeah. Have a wonderful day. All right, guys.
Yeah.
All right.
Thanks so much, guys.
Cheers.